Thank you for joining us for another episode of Proudly in Conversation, the podcast where real voices open up and explore the conversations impacting LGBTQ+ communities in everyday life. I'm your host, Simon Blake, and today I'm really pleased to welcome Dr Sarah Hughes, CEO of Mind. Sarah's worked in mental health and social justice for more than 35 years. Today, she's a regular voice in the media and a trusted advisor to governments and organisations around the world. For more than 3 decades, she has built movements, challenged systems and shaped culture, always with justice and equity at the centre of her work, values that strongly resonate with us here, Sarah. Welcome. It's a real pleasure to have you with us today.
Thank you.
Could you just tell us a bit about your career history and why you wanted to come and sit on the sofa and talk to us about LGBTQ+ issues and mental health?
Yeah, amazing. Well, we could be here till the end of time because I'm as old as paper now, but let's start somewhere. Well, look, I've worked in mental health for 36 years, right? And it's my life's work. I feel incredibly passionate about it. Mental health was part of my life growing up, family, friends with mental health challenges. It was really, really big and prominent, right? So it was, I always understood it, knew it. I was never frightened of it. And I had quite, big experiences around mental health. I watched my grandmother and other relatives, be inpatients in psychiatric units. At 11 years old, I was playing with psychiatric patients in the grounds of Free and Barnet. So I kind of, I have this in my DNA, right? But in relation to sexuality, gender, this kind of space, when I was, it's important, right? So I went to a all-girls Catholic high school, grammar school in Hackney. And as you can imagine, it was quite tough, run by nuns, who I loved, by the way, who still inspire me today. But it was a Catholic school, so conversations around anything other than our curriculum wasn't really very usual, put it that way. But I had this teacher, and if she is listening, Maureen Price was her name. And I think I was probably about to join 5th form, which is probably year 11 now, maybe a bit sooner. And she was my RE teacher. And she, I actually don't know whether she came from the community or not, but I imagine she might have done, because she had a fluency around sexuality and gender that I'd never heard before. And I came from, again, a very open family. So it wasn't as if we didn't have those conversations. It was meeting somebody who clearly had a fluency about sexuality. And I was fascinated by the way she spoke about it. And she took us, a group of probably about 16 of us, she took us to the London Lighthouse.
Okay. For those who don't know, do you want to just tell us what London Lighthouse is? So
the London Lighthouse at the time, I don't know where it is, in terms of what it's still doing, but at the time, early 90s, it was a residential support clinic, therapeutic community, residential, almost hospital for some people, palliative care for others, people with HIV and AIDS. And I don't think I will ever forget that visit. And I was 15. She took us, we met patients, we met family, we met members of staff. We saw the beautiful blankets that adorned the walls. I don't know if you ever have been there and saw those blankets. The stories of the lesbian community who stepped up to support their gay brothers. Again, that it kind of ignited something in me. And then I just read a lot of stuff, right? The Tales of the City books, and big queer fantasy stories. And then, of course, I live in the world. And so I live with and love people who are part of the community. And it's important to me. And, of course, growing up in a mental health world, it's been clear to me that because of stigma and discrimination that's attached to the LGBTQ plus community, that resonance with mental distress and crisis and depression, anxiety is strong. And strong, not because individuals are not resilient or can't cope, but the corrosive experience of discrimination and stigma is lifelong for some.
Yeah. Could you sort of take my breath away thinking about the Lighthouse? Yeah. And so how forward thinking of a teacher, to take you there as 15-year-olds, and what a powerful experience that would have been at a time when people were dying from AIDS rather than living with, which of course, the advances have taken us so far through. I mean, we've known each other a long time.
We have.
And I know that equality is in every bone of your body, as whether that's about social mobility, whether that's about racial justice, whether that's about gender equality, women in leadership, etc. But I guess I'd just be really interested to get your sense of the world now in terms of where we are in terms of mental health provision for people, where we are in terms of societal cultures and stigma and prejudice, and our understanding of the relationship between inequality, prejudice, stigma, and mental health. I mean, you've been at Mind now
3 years, but I actually got my first job at Mind when I was 18. Yeah. So I'm a Mindian. I've just made that up. Might quote that in future. Anyway, I mean, the deal is that inequality, whether that is on a basis of racism or class, which is an experience that I've had over my lifetime, is toxic to your mental health, full stop. It's not just a little bit harmful, it's very harmful. In terms of racism, we see it every single day played out, not just in terms of the experiences people have in services, but the fact that people don't access or can access services at all. Yeah. When I think about, the community that we care about the most, the provision is poor. The cultural understanding of the LGBTQ plus community's experiences is really poor. Mm-hmm. And so, you in the end have to develop specialist services. And of course, that means then that you have a postcode lottery access. So if you live in Brighton, you might have a better chance of accessing a culturally or, more appropriate service for questions or reflections around your sexuality than you might if you were in Tottenham. Yeah. So this is the nature of that postcode lottery piece. So we constantly at Mind are talking about equality of access, the corrosive implications of being effectively an excluded person on whatever basis. Yeah. And yet inequality grows at a rate of knots every single day. And it's almost as if we are now colluding with that trajectory rather than stopping it. And this isn't just about the government could tackle that. This is also about us and about how we as a society, almost I think what we're seeing in relation to mental health, and I know that we're seeing it in relation to, some of Stonewall's work, this sense of we've gone too far. Mm-hmm. Now, the idea of we've gone too far in equity and justice literally blows my mind. And yes, I can see that there are some unintended consequences of some of the things that we've campaigned for over the years. Nonetheless, I know for sure that if you are trans today, your mental health experience is going to be vulnerable, not because of who you are, but because of the life in which you find yourself in, because the environment is hostile. Yeah. And those two things aren't compatible for a thriving mental health scenario. Yeah.
And so true around, we see the report, around trans and non-binary people. There's also a 7-year-old who just feels different, who has no name for it, but yet that sense of when they're trying to get that sense of attachment and love for themselves, hearing, seeing, is just something that I hope in my lifetime we'll see some change for. You use the word collude I'm really interested just to,
Yeah.
who's colluding with what? Just talk
I think
to me a
we're
bit
all
more about that.
colluding, right? So I think that we have not, as a nation, and I can only talk about the UK because I live here, but we haven't, as a nation, really truly understood the intersection between vulnerable groups, whether that's from race, sexuality, gender, whatever.
Yeah.
The intersectionality with poor mental health, poor life outcomes, poverty, poor housing, poor education, all of these things wrap around individuals.
Yeah.
And we still hold a kind of very individualistic approach. So can't they just cope better?
Yeah.
Can't they just be a bit more resilient? Well, actually, if you're a kid, that 7-year-old kid who, might be living with parents who don't understand, don't know how to respond, you're in a school in a, rural place where there aren't many people like you or seemingly many people like you. There's no one to talk to. The news, we talked earlier on about me putting the news on this morning, and some of the storytelling around these key issues is so abrasive that the hostile environment seeps through, right? Seeps through. So these 7-year-old kids, where their parents might have the news on in the background, and then that story might come up about whatever. That is the kind of noise that people are listening to all the time. And we can keep looking to the government for these answers. But actually, some of this rests with us, how we as a nation, how we as a people respect and understand each other. Yeah. And I think until we do that, we may never get a government that reflects or can make decisions in the way that we'd quite like them to be.
Yeah. It's really interesting how you think about we as individuals, as families, as communities. If we were to go into a village hall, so this is a very random question, but
love a village hall.
If we were to go to a village hall and there were 100 people who were saying, right, what can we do? What should we be doing? How do we create that community which builds trust, which builds inclusion at its heart? What sort of things would you be saying to them that we could do to, I guess, intercept the collusion? Make sure that we are not inadvertently colluding?
I think that's a great question, and I don't know that I have a really sophisticated answer. But what I know, when I see it work, so for instance, I keep talking about it everywhere I go, but where I live in Cambridgeshire, in my town, there is a fairly new, probably, it's not hugely new, it's been going for a couple of years, but something called the Citizens Hub.
Yeah.
And the Citizens Hub is made up of an organisation that wanted to bring communities together. I live in a place where, there isn't much going on, right? So the community, the Citizens Hub brings people together, brings volunteers together. There's no age kind of barriers. It's all age. It's all kind of types of people, people with protected characteristics or not. There are, it's mutual aid. It is based on principles of love, respect and dignity, using the language of love, respect and dignity, which, if you're in services, we often kind of, that gets trained out of us, doesn't it?
Yeah.
But it's about that, bringing the human back into the conversations. I met this fantastic activist last week called Tuan, who is a Danish activist who, at 21 years old, moved into a nursing home for 3 years as a housemate with people with dementia, right? And his conclusion is to bring people together. It's about recognising our humanity first, and of course, people like us, when we talk about that out there, it sounds really naff. I wish there were better words. But the reality is that's it. When I talk to my kids about what are the conversations around acceptance and inclusion at school, they're really small conversations. They might have one in PD or whatever, but really small. Now, this should be wrapped up in every single subject. I mean, I'm sure you can get equity and acceptance into maths.
Yep.
I'm not having it that you can't. But there is no golden thread. We're not teaching our children how to accept each other. And therefore, children and young people are looking at social media for that, or, you know, other places for that. Yeah. So when you talk about a village hall, I in my mind, I'm thinking about, how do I just strip away? How do we just help them strip away the barriers, and really, you know, power up the humanity? And I think at the moment we've got a couple of factors that are really creating huge problems in terms of that, and that is misinformation, the way our politics is kind of rolling around, the 24/7 kind of hostility, or the them and us, the polarization. You know, if we're trying to support the Black community, for instance, there's this idea that therefore somebody else must be missing out.
Yeah,
that can't be true,
yeah.
and I do not accept that's true.
Yeah. Just to go back to your bit about teaching equity in maths, LGBT inequalities in mental health, what are the percentage differences, disparities, all sorts of ways which you can do it, in all sorts of ways. And the interesting bit about that, you said, it sounds naff, but humanity, our common humanity, keeps on coming up in this podcast. How do you keep thinking about what it means to be human? How do we bridge those divides? So hopefully, if there are enough of us, whether we think the word is naff, but the sentiment is there, we can create some of that. Misinformation, narratives, storytelling. You've been a Mindian for a long time, and you've seen how storytelling can shift for the positive, but also how it can revert and change again. And I just wonder whether there's anything which we can learn, perhaps, as we're thinking about how to build positive narrative around people from LGBTQ plus communities, from the work that's been done in mental health over time. What does it take to shift a narrative? Because we feels a bit stuck.
Well, I mean, and of course, whilst there has been a huge amount of progress in mental health, of course, that's coming round again because progress is so fragile.
Yeah.
So the storytelling, I've kind of come up with a new phrase around narrative laundering, right? So the thing that I see happen now is that we share our stories, and for a long time, they have been compelling and persuasive.
Yeah.
Now we're placing those stories in an environment of polarization.
Yeah.
And so, there's the narrative laundering, which is I'll just draw out the bits that demonstrate my argument. So, you'll have a wonderful story about, a young gay guy who is, doing great, entrepreneurial work. You might then have somebody who'll say, well, you've got that far because you're gay, and you've the gay privilege. I don't have that. So you've constantly got that push and pull tension, which is a fairly new phenomenon, actually, in terms of storytelling. So that narrative laundering, I'm going to take what I want, and that's going to support me. So any story that you tell now, you have to be prepared for it to be taken by both sides of the argument, even the argument that you really don't want it to be taken up by.
Yeah.
And we are increasingly finding that in mental health.
Yeah.
There's the other thing about storytelling now, which is there's always a kind of polar opposite perspective. And on social media, I think it's called the bean soup theory.
Okay.
It's I love this theory, and it came from this woman who posted a bean soup recipe. And then all of the comments were, I don't like beans. And why? And you're like, fuck off. What do you mean you don't like beans? It wasn't for you. This recipe, don't look at it then. But and so we have that, don't we? So we have our people, or certainly I think about our mental health storytellers, and they're telling their stories, and people who really couldn't care less are putting their oar in. And you're like, look, move on then.
Yeah. Yeah. So everyone has an opinion.
Everyone has an opinion
about everything.
Yeah.
But also interesting, you talked about the two sides, and of course that is also part of it, isn't it? The you're 100% in, or you're 100% out, or you're 100% against, or you're 100% for, rather than through conversation we come to understand, we come to develop empathy, compassion, and understand that sort of shared humanity. I'd be really interested. You've been at Mind in this role as chief exec for 3 years, and Mind does some really interesting work around all sorts of inequalities, and whether there are some examples of work for LGBTQ plus communities that you just have been really struck by.
Yeah. So people may, who listen in, might be familiar with Rainbow Minds, which is a initiative that runs across two local Mind organisations, really spun out of one of our local Minds, run by a great chief exec who basically said, we need specialist services. We need services that are culturally relevant, that are really understanding the experience of our LGBTQ plus community now. And it provides counselling, training, advocacy, and so on. And it's called Rainbow Minds. I don't know if I said that a minute ago. So Rainbow Minds. And that work continues. It's loved. It's not scaled across the piece because of all sorts of funding barriers and so on and so forth. But what we know from that service is that the outcomes around inclusion, acceptance, recovery, well-being is huge.
Yeah.
So, and distinctive from services who don't provide that level of cultural understanding of the experience of being gay today, being trans today.
Yeah.
And I think that recognising, and these services specifically, understanding the nature of the mental health distress, very specifically what it's related to, because distress is not the same for everybody. It's not the same for, two people who, might identify as gay will not necessarily have the same experience, but nonetheless, there will be a golden thread.
Yeah.
And so having an organisation or a set of services that can understand that is extraordinary.
Yeah.
What they would probably say, though, is that these services are often in isolation of everything else.
Okay.
And that's because often when people experience those sorts of culturally relevant services, then nothing else makes sense.
Okay.
Because generic mental health services then become quite alien.
Okay.
Because they're not relevant.
Yeah. That's interesting, isn't it? Because we want both the specialist services for people who need them, but we also need enough within generic services for people to be able to access them for whom that feels relevant as well. So really interesting. And we can, I'm sure, find a link to Rainbow Mind to put it in the show notes. We can make sure that's there if people want to find out more. Just want to go back to the 7-year-old bit, if we can, because obviously one of the things which we talked about, one sentence before we came on here, is about who next as leaders for civil society. And one of the things which I know you've always been very good at is cheerleader of the people who come next, doing all sorts of things in order for people to be able to see people. You've talked about class openly as chief exec within civil society. You've done a doctorate around women in leadership. And I keep on hearing people say the next generation, it's all going to be okay. And I have so much faith in the next generation to take things. But I just wonder, as we think about that culture, the context, I know Mind has been engaged in the conversations about social media and the responsibility of big tech companies. How do we create the foundations in which children, young people can start building a future, which maybe will be better, brighter, whether someone's lesbian, gay, bi, trans, non-binary, queer, however they identify? Because at the heart of all this, it is the next generation who are paving the way.
Well, I oscillate from being incredibly worried because I'm a mum. I have 2 teenagers now. The youngest
I'm
one,
sure
which is
they were
13 on
5 and
Saturday.
3 or something last time we spoke.
They're now 13 and 16. And I feel worried for them because on one hand, I see the world is burning and I think I just can't reconcile that in my mind with how we support young people to thrive when they're facing that. But equally, I feel huge hope. So my little one, Sasha, who's 13, conversations with her about feminism, equality, justice are so incredibly sophisticated in a way I would never have been. And frankly, I meet a huge number of adults that are not as sophisticated as she is in terms of the way she understands equality, justice. And my oldest child wants to work in social care. I mean, I have tried to advise against it and say, can't you be something in tech? Pay for the mortgage, because working in social care, you're not going to pay off my mortgage, put it that way. But anyway, that's a different issue. So I see huge hope. And I feel that they have an understanding of the world in a way that we didn't. So they've got a kind of much more nuanced, sophisticated worldview. The issue isn't about them. It's about what we leave behind and the conditions that we create for them.
Yeah.
And so that's the bit that I'm worried about. I'm not worried about them. I'm worried about us. And I'm worried about this narrative that says, kids are not going to school. Kids are not going into education. Well, yes, but when we ask why, can we really ask why and not focus on the kid doesn't want to go to school because they're not resilient? Actually, the kid doesn't want to go to school because there's no community there. Yeah. Don't keep telling me that kids need to come offline when they haven't got a compelling reason to.
Yeah.
So when we think about the last decade austerity that stripped out more than 70% of children and young people's provision, don't then ask me why they're not thriving.
Yeah. Yeah.
Because these are the basic principles of what every human being needs to thrive.
Yeah.
And so, yeah, that's what I'm worried about, Simon. I'm really worried about that.
And me too. And I guess the question then has to be, how, in a world in which sometimes it can be difficult for people to find hope. I'm an eternal optimist and therefore, annoyingly for some, do constantly find hope. But how do we create those conditions? We have to be able to be. We are the adults here. We are 100%. People in positions of leadership. We are working in a society which is about civil society, which is about social justice. So if you had a bit more time in every day, and I know that time is of the essence, but what might be some of those things to create the conditions? Right.
So firstly, I love the fact that you hold on to hope in the way that you do. And I've always valued that about our friendship. And, working with you, I've felt that deeply in the kind of depth of COVID. Remember those Friday morning meetings when we're desperately trying to work out how do we persuade the government they need to pay attention to mental health while everybody's locked down in their house. And your ability to cut through the despair was always incredibly important. And I've always had a mantra pretty much from when I started working in mental health that our role is to hold on to hope when all hope is lost.
Yeah.
And it's almost, should be written into our job descriptions.
Yeah.
Now, that's not to say you won't also tell the dark truths, because, I'm always going to tell you the dark truth.
Yeah.
But I believe that we can change the world. But mostly we have to do that in solidarity. There's no one person that can do it, and you will never do it alone.
Yeah.
We hunt in packs in relation to, social change specifically. If I think about just the small things that that I do for my kids to hold on to hope. So my two children, Billy and Sasha, ever since they were babies, we've had what we call bed chats. And the bed chats every day might consist of, when they were little and more pliable, frankly, I could get them to do meditation and, we used to do all these sorts of things around bedtime and reading stories, etc. Now it's pretty much, a gossip with rude words and my kids moaning about their teachers. Sorry, teachers, but they do moan about you. And it's very much an opportunity to connect with them, to recognise them as individuals and to hold that optimism, hope, belief in them.
Yeah.
That they are the masters of their own lives, right? So those are very small things that I can do for my own children. On a bigger scale, I see that my role as CEO of Mind, not colluding with this idea of the lost generation.
Yeah.
And whilst I do think that children, young people, especially those who've got protected characteristics, even though those children, young people are quite vulnerable, I don't believe they're lost. I don't believe that they aren't resilient. And, when you speak to people, I remember working in a fantastic project in Tottenham, and one of the guys said, one of the worst things that is said to us is, could you just be more resilient? Do you not see my resilience? That I'm surviving every day, that I live in a very, very kind of, hostile environment. I don't have any money. I don't have any job. I've been excluded from school. My parents are working 24 hours a day. That's resilience. The fact that I'm here is resilience. So I think that we need to stop putting our children and young people down, stop thinking about them as lost. And actually, the big shift for us, and I'd like to see this generally, is that we come from an asset-based perspective.
Yeah.
What are we doing? How are we doing it? Where's the community? How can we scale and grow that? How can we point out the best things that are happening and not just sit and admire the problem, which I'm afraid civil society can do. Yeah. We're very good at admiring problems and shouting about the problems. We do need to make the shift to say, okay, we are collectively responsible for the solutions.
Yeah. And historically, of course, that's what civil society was so good at, wasn't
Indeed.
it? It was about stepping in, finding the solutions, and Mind and Stonewall and many others, have just done that. And I love the phrase admiring the problem. And sometimes it's, and let's just give you the problem.
Yeah.
And it's how do we take control of actually we're going to help to shift that problem. If I just to think a bit about you as chief exec, and you just spoke about the fact that people often say you're not resilient enough. And I think what lots of people in the LGBTQ plus community right now are hearing a lot of is you need to be resilient or you will overcome. And I growing up in the 80s, know that bit about every day waking up and hearing and seeing something about gay men, and that sort of corrosive effect. But what would be your message of hope into the community in this moment of time, or your message of solidarity?
So certainly Mind stands alongside Stonewall, and we are in solidarity with you and the people that you care about the most, the people we care about the most. They're the same people, right? And that for me is really important, that sense of closeness, intimacy between us in terms of understanding the issues that we're fighting individually and together. And I feel and see a lot of hope in that.
Yeah.
The thing that I guess I come back to the young person that I met last week who is now 24, who did that 3-year stint in a nursing home. Look for the glimmers. So we talk a lot, and I've spoken a lot about this, I think, in other places, about we are now a world of triggers. Yeah. We're triggered every single day. I mean, I was triggered from the station to here, right? On many different levels. And seeing somebody who's on the street homeless and an attitude of somebody who walked past them, which was not one of compassion, put it that way. If it wasn't for the fact that I was a bit further away, I would have chased them down the street. But anyway, again, another issue. But we have to look for the glimmers, right? So, rather than see that person, throw a wrapper down at somebody who's homeless, what about that person who takes a cup of coffee to that person who's homeless and sits with them for 5 minutes? Where, can we hold on to that? And that helps us carry hope, helps us carry the belief that we have got a chance, a fighting chance of coming out of whatever this is. So look for the glimmers is my word on that.
Such a nice way of thinking about it. I was really lucky to listen to Jacinda Ardern a while ago, and she talked about optimism often being seen as a weakness, but she had to reframe it as being about moral courage, because without optimism, you're saying, I accept what is, I'm willing to put up with what is, and I'm willing for you to put up with what is. So that look for the glimmers, look for the hope, look for taking moral courage, and creating change. If you were to look forward 5 years from here and just think, if I could make one thing different, what would it be in relation to LGBTQ plus stuff specifically? Because it could be all sorts of things. But I'm conscious that we can do a lot of rear view mirror looking, and part of being hopeful and looking for the glimmers also means that we have to have the long-term view. And I know you're in lots of conversations about what does the long-term view look like?
Well, firstly, I think, so when I think about 5 years' time and I think about mental health specifically, I want to see 24/7 community access for people with mental health challenges across the spectrum. I want community hubs across the country where people can just walk in and they can get the help they need there and then. I want to see an investment in community. So again, if I think about local authorities who often fund quite a lot of the public health stuff and the community activities, etc., I want them to reprioritise that. Austerity stole that from us, right? And I use that word, specifically.
Yeah.
I want community back, and I want community back for all of us.
Yeah.
And that means resource into towns, village halls, into those small grassroots groups that are providing that support for those kids who are 7, 8, 9 years old, who don't know who they are, where they're going, but know that they're different. That's where it's at. I want to see community back. I want kids to be able to build relationships offline, and they want to. When I talk to children and young people, they want community back. Yeah. They know that it's missing, and they're looking for it, and they're finding it in dodgy places. Yeah. But that's because it's the only place. So 5 years' time, I want 24/7 culturally appropriate access for everyone, and I want community back.
Yeah. Such an important bit, isn't it? Community, and obviously the LGBTQ plus community has built in so many different ways, and some of that nightlife, and of course nightlife has shifted and changed, and we need to think about all of those things to, how do you get the youth clubs? How do you get the social groups? How do we make sure that all of that is available? Yeah. So one last question.
Yeah, go for it.
One last question. If you were to think about a book, a podcast, a film, something that inspires you, something that you'd like people to know that you think is good, what would it be? It doesn't have to be LGBTQ specific.
It was really easy one, Schitt's Creek. And I don't know whether anybody said that to you so far, but when I saw Schitt's Creek the first time round, and now it's one of my comfort shows, right? What was really clear was, and I've watched many interviews with Daniel Levy, the writer, and who plays one of the main stars in it. He specifically created a story where discrimination didn't exist. You can't find it in the show, right? This is a world where it just doesn't exist and it's no big deal. Do you know what I mean? It just is no big deal that it doesn't exist, and everyone's all right.
Yep.
And there's nobody losing out. And it's a program of joy and love, and I feel like it gives you a vision of what the world could be like. And of course, I'm so sad that Moira is no longer with us. But there is a world out there where that has to be possible. Mm. And so if you haven't watched it, go and watch it, because it will bring you joy and love and hope.
I've never watched it. I'm going to.
Immediately. You have to, this has to be your number one priority. It is, honestly, Simon. I remember watching it for the first time, getting to the end, and me and my husband both just weeping, with both sadness it was finished, but joy, because it's joyous. Mm.
Sarah, thank you. Thank you very much for talking to us, and all the hope and the joy and the courage that you show day by day.
Always, and you. Thank you, Simon.
And if you've enjoyed the conversation with Dr. Sarah Hughes, please do subscribe to the channel so that you can stay up to date with future episodes of Proudly in Conversation. Today, we've talked about the systemic challenges in mental health care, particular pressures facing LGBTQ+ communities, and why awareness alone isn't the same as real support. If the conversation sparked any thoughts, questions, or ideas, we would love to hear from you. You can get in touch via the email address in our bio, and if you or someone you know is struggling with their mental health, remember there is help available. You can find information and support in the show notes and through Mind. I'm Simon Blake. Thanks for listening, and I look forward to sharing more conversations like this with you soon. See you next time.
LGBTQ plus you plus me.